Over 10 million Americans have osteoporosis, with millions more at risk. As we learn from Dr. William Batty of St. Jude Medical Center in Fullerton, with early detection, osteoporosis can be controlled and bones can be strengthened.
Osteoporosis is a disorder of decreased bone mass and structural changes within bone, which ultimately lead to fragility of the bone as well as increased risk for fracture. Both men and women are at risk for osteoporosis. In general, men and women lose bone at a rate of 0.5 to 1% per year, starting at around the age of 35. Women, however, are at increased risk for osteoporosis once they are postmenopausal and may lose bone at a rate of up to 3 to 5% per year for a period of up to 10 years. Peak bone mass is generally reached around the age of 25 to 30. Now, bone is very dynamic and constantly undergoing change, so keep in mind that when the rate of bone breakdown is greater than the rate of new bone formation, you have net loss of bone. In general, screening for osteoporosis occurs in all postmenopausal women greater than age 65. At ages less than 65, you want to consider screening women if they have risk factors for osteoporosis. The risk factors for osteoporosis, you want to consider things which affect bone mineral density. Most important thing are genetic factors such as female gender, race, body habitus, as small women tend to be at increased risk for osteoporosis, as well as environmental factors such as nutritional status, calcium intake, and consumption of alcohol, as well as tobacco use. Chronic medical conditions can also put you at risk for osteoporosis, such as hormone disorders or thyroid disease, and some medications, such as steroids, can put you at risk for osteoporosis. For the treatment of osteoporosis, not only medication can be used to prevent fractures and treat the disease. For example, weight-bearing exercise is one important thing which can be done to help maintain bone mineral density, as well as maintain strength of muscles. The particular class of medications which are primarily used for treatment of osteoporosis, studies have actually shown that in addition to increasing bone mineral density, you have decreased risk of fracture at all sites, including the hip and the vertebral bodies. Exercise is another important aspect in the prevention of osteoporosis, as it helps maintain bone mass, but also can help maintain muscle strength and prevent falls. Weight-bearing exercise is one important thing which can be done to help maintain bone mineral density as well as maintain strength of muscles. Including enough calcium in your diet is another important aspect, and foods which are rich in calcium include dairy products, fortified juices, sardines, to name a few. The most common sites of fracture in osteoporosis are their spine and the hip, and sometimes the distal forearm. The most common types of vertebral fractures are wedge fractures, where a patient may have collapse of the front portion of the vertebral body. These are usually asymptomatic. However, with multiple fractures, they may note that they've developed forward curvature of the spine and may even have a hump. Of course, the most feared complication of osteoporosis would be a hip fracture. Within the first year of a hip fracture, there's actually increased mortality. And whereas a patient may have been completely independent and functional prior to the hip fracture, after the hip fracture, they may require assistance with ambulation, with activities of daily living such as dressing, toileting, transfer, and may even need placement in a skilled nursing facility. In order to prevent osteoporosis, it's important to understand the risk factors for osteoporosis and which things can lead to decreased bone mineral density. It's important to make sure that you have enough calcium in your diet, and if you're not meeting the daily recommendations, perhaps consider a calcium supplement.